Welcome back. I hope you're learning lots and having a great time. I'm Dr. Susie Heugly. I work with the Doctorate Nurse Practitioner program at Weber State. Great. So we've talked about shock. We've talked about the stages of shock, and I'm going to talk now about specifically hypovolemic shock. Why, you ask? Well, it is the most common type of shock. It's caused by a decrease in that intravascular volume, okay? The volume we need to carry oxygen, rich blood, and nutrients to our cells, tissues, organs. It can happen from a traumatic blood loss, from severe enteral fluid shifts, severe dehydration, severe edema, or even ascites. So let's talk a little bit more about hypovolemic shock. What do we do to treat it? Well, first and foremost, we have to treat the underlying cause, and we need to get fluid management. So hypovolemic, hypo, not enough, volume, volemic, we've got to replace that volume right away. So we need to use isotonic fluids. Our isotonic fluids we know are NS and LR, are stable ones. There is another one with glucose, but it dissolves as soon as it gets into the blood compartment, so we don't use that. But we do use NS or LR. Those are our isotonic fluids. And then we need to make sure that we have pharmacologic therapy if the fluid replacement isn't enough. Well, pharmacologic therapy, that sounds very complicated, Susie. What? All that is we need to get drugs on board. And what are those drugs going to do? They're going to help with that vasoconstriction, so we can get great blood flow, so we can get that beautiful oxygen-rich blood out to the cells, tissues, and organs. We're going to get a little help from medications. The problem with that is when we use these very, very strong hemodynamic blood heart medications, we have to start very slow, titrate very slow, and really watch those vital signs of our patients. So, not just for hypovolemic shock, but for all types of shock, early identification and timely treatment is the key. We need to treat that underlying cause. And the other thing is we need to make sure that we get early nutritional support. We need to make sure that, because with shock, in the compensatory stage of shock and the further stages, our body shunts from those least vital organs. And one of those organs is our gut. And if we don't use it, we lose it. So if we get an ET tube or an enteral tube down into the gut and feed and stimulate those GI cells, we don't lose them. We don't get paralytic ileus, and we don't lose the function of those cells. So the sequence of events for all types of shock will vary, and then management for each patient will vary, and we want to treat the underlying cause. Thanks, folks. Have a great day.